we should have the power and the knowledge to be able to make the right decisions about where we get care based on convenience, based on access, based on cost. And really, that's what we're focused on doing.
Hey, everybody. Thank you for joining us and welcome to the Founders in LA podcast. I'm your host, Ethan Cole, and this is an opportunity to shine the spotlight through the product lens on some of the exceptional founders we have as part of the LA community in an unedited, one-take, organic conversation. Our guest today is Ahmed Marmoush. Thank you so much for coming down to the studio today, Ahmed.
Thank you. It's great to be here.
All right. Excited to talk to you and Handle Health. But first, a word from our sponsors. Founders in LA brought to you by United Club. United Club is a co-working space that sets itself apart. Locations in El Segundo, Manhattan Beach, and Hermosa, United is where creativity flourishes. Unlike traditional offices, they provide an inspiring environment where ideas can thrive and businesses can grow. With United, there's no hidden fees, flexible terms, options for dedicated offices, and unlimited access to conference rooms, a photo studio, this podcast studio, plus standard and 3D printers and 24/7 access at any of their locations. They're local champions who support neighborhood businesses, open their event spaces to nonprofits, and celebrate art, music, and culture. Join United Club and experience co-working like never before. Learn more at www.unita.club. We're also brought to you by the Product Managers Association of Los Angeles, available at pma.la. They're the largest professional organization for product and designers in LA. With more than 4,000 members from over 500 companies, they host monthly meetups, organize a product leader council, and have a mentorship program where they connect working product managers with students from underrepresented groups to build a better, more diverse next gen. Learn more at pma.la. With us today is Ahmed Marmoush. He's the CEO and founder of Handl Health. And Ahmed, could you just give us a 30-second description of Handl Health?
Sure thing. At Handl Health, we're building the next generation of health insurance for our employers. Most of us actually rely on our employers for health insurance in the US. And the cost of health insurance is second only to payroll. The best part is nobody knows the cost of healthcare, not even when we're going to get a service, but importantly, not our employers who are designing the plans from the ground up. So what we've built is a platform that calculates the cost of healthcare, and it's used by HR leaders and their benefits brokers to design insurance plans for their employees. And then once they activate the insurance plan, the employee can use that same data to be able to find the care they need and understand exactly how much they can expect to pay.
Oh man, that is definitely a pain point that hits home. Like I couldn't tell you how many times I've gone to the doctor's office, and the staff themselves don't know the literal costs of the things that they're doing. They have a sense of the care that you could or should get. And I guess and oftentimes there's kind of trade-offs that they do or don't do internally, but the true customer cost is rarely understood by the folks who are providing the care.
Yes.
And I think that's doubly or triply when you're talking about, the HR people within your company who are helping you determine what plan you should get or helping determine what plan the company should start subscribing to or not. So you're providing visibility in a place where it's super murky. That's incredible.
Thank you. Yes, it's no small challenge to be able to do, and I think you've hit the nail on the head there. It's often we are going in to receive care, and the people that we're receiving care from have no idea how much healthcare costs. And the reason for that is that these contracts that exist between insurance carriers and between providers are negotiated in dark rooms by people that are considered administrators, right? So they're nowhere near the front line of care delivery or receiving care. And then through a raft of long and archaic processes that have existed and sort of evolved over time to protect the interests of both doctors and the insurance carriers, it's created more and more convoluted and difficult to interpret and understand rules for how healthcare is even processed and how a bill is generated. And so the entire thing just needs to be wiped clean and really designed with the consumer in mind and with technology in mind. And really that's the world that we're hoping to build.
That's a world I'd love to live in. It reminds me of I believe it was a news article, or it was a story on NPR at some point, and it was an interview with an executive at an insurance company, and whoever was the interviewer, it actually could have been Kai Rizdal, it could have been Marketplace. I think he pulled out like one of those things that comes in the mail, says this is not a bill, and handed it to that leader and asked, "Hey, could you explain what this is to me? Because I don't understand. It's not a bill. Like, what is it?" And that leader had difficulty trying to explain what that thing was that was mailed and what it meant and what all the things in that that envelope actually meant.
Yeah, yeah. It's wild. We often use the analogy of like a restaurant menu without the prices. And to some extent, it is the provider's responsibility to select the right options from the menu based on what you need. But why is it that the price can't be there and that people can understand that if you're buying a certain item off that menu, that it will cost X specifically for you based on your insurance plan and how much you spent towards your deductible and out of pocket maximum?
Yeah, and from a personal note, my wife is a nurse, and she's in a labor delivery, and deals with a wide range of patients. Some are more well off, some are not. And so some of these decisions that need to be made in the room uh, can be challenging. And so, is this particular thing that maybe is a nice to have that we do for most of our patients, and it may or may not really impact the outcome, and certainly doesn't hurt the health of the patient. Is that something they want to do? Well, the nurse doesn't know the true monetary cost, and the patient may not even know that it's a thing that they can get charged for.
Yeah.
We certainly had that when one of my kids was born. There was, I forget what it was, but there was some charge, and we're like, what is this? Oh, we thought that this was like something that they were doing for like something that came as part of the price, and then it showed up as a bill in our door. Um, and I forget which one, but it is potential that like we may not have done it had we known the cost.
Yeah, yeah. There is this challenge of information and knowledge asymmetry, right? As patients, we can't be expected to have the knowledge of our care providers, and so we are immediately in a position of information asymmetry, or being slightly disadvantaged from that perspective. And so we trust our care providers to make those decisions on our behalf, and often they're not doing anything malicious, right? They're not making these decisions to the detriment of our pocket. They're probably doing it to the debt to trying to cure you to get to the right outcome. But there are downstream consequences of that that we often feel, both from an employer perspective in their pockets, and then that is passed down to the employee, and we feel it as employees, but also as consumers in our pockets.
So, how did you find yourself in this problem space? It's certainly one that is pervasive in America, based on your accent and our pre-interview. And it sounds like you may not be from here. How did you find yourself trying to solve this particular problem in this market?
Yeah, it's an interesting story. It starts with actually me being a pharmacist by training. I come from a family of pharmacists, and so helping people has just been in our DNA. It's just what we're born to sort of believe that we're supposed to do, right? And when I first started practicing as a pharmacist, I was frustrated by working in a system that I felt wasn't equipped to help people like clinicians succeed, for example, or patients succeed. And so I dedicated the best part of about a decade of my career working and consulting, trying to solve some of the systemic challenges in healthcare, but from a management, administration, and policy perspective. And that took me around the world. I had the chance to work across New Zealand, Australia, the UK, and then in 2019, I had the opportunity to come to the US to help with building out a practice focused on digital health. And interestingly, it was very much focused on how do we bring the principles of government-sponsored healthcare around maximizing population health outcomes, using technology to reduce total cost of care, and really focusing on minimizing spend to improve the well-being of patients. And through that process, I came to the US and realized my employer was responsible for my healthcare, which I thought was extremely perplexing. And then B, I realized they just simply weren't equipped with the infrastructure, with the technology, or the time, quite frankly, to effectively design insurance plans. And so the more I sort of dug into this problem, the more I saw how much inefficiency and waste was going into the system that you and I ultimately pay. And that's when I decided it was really time to dig into this problem. And it just so happened at that point in time that huge pieces of legislation, landmark pieces of legislation, were passed in the US that mandated that the prices of healthcare were to start being published publicly. And it just overwhelmed the industry with thousands of, and actually hundreds of millions of pricing data points.
Wow. So you found yourself at this point, and maybe part of it comes from the fact that you saw what the good life could be like. You saw what in other places how healthcare could be more transparent, and then you arrive in the States at a time of the dawn of transparency.
Exactly. Well summarized. Yeah.
That's incredible. And so, you decide to form this business. How did you decide to go about? Like, how did you find your first clients? This isn't, this isn't really a consumer app. It's not something you can just go on Instagram and start advertising. How did you get those first clients?
Yeah. It's funny. We started with one mission. It was to equip consumers like us with the information we needed to make the right decision about where to get healthcare. And it was a bold vision, I think you could describe it as. And we learned very quickly through that process how many actors were involved in the formulation of insurance plans and access to healthcare. And so we started with the idea that we would empower the consumer. And where that journey took us to was really about understanding the role of the employer and the different actors that held data that was so critical or pivotal to us being able to calculate the cost of healthcare accurately and down to an individual level where it was personalized so it was relevant to you. And that journey in itself, wow, it had some. There was a roller coaster ride. You could say that, to say the least.
And how many years was that? Was that roller coaster?
I would say, we incorporated about a year and a half ago, and we've been doing. I would say it's been about a 2-year journey of doing this on off the side of our plates for a while, and doing some of this learning and discovery.
And it sounds like it was, what you're describing is really, product market fit and trying to identify, should we go, B2C? Should we go, directly to consumers, or should we go B2B, which is, should we work for other companies on behalf of other companies? And where have you landed today?
Yeah. Yeah, exactly. I think you summarized it well there. And where we landed was today we are a B2B company. And part of that was the process of discovering where we were best positioned and the capabilities we had to be able to enact the most change and create the most value. And what was really interesting for me was we had done a competitive analysis. We knew who the players were in the market, but what we I think initially failed to realize was the influence and the decision making that happens on behalf of our end users, and therefore the sometimes misaligned incentives that exist between end users and buyers. And so I could talk a lot more detail about the specifics there, but it's important to understand the nuance of who uses your products and who pays for your products. And we ultimately landed on this concept of serving HR leaders and their channel partners, who are benefits brokers, to help them design the best plans and use our data to power different applications that meet the needs of or are put in front of employees to help them find the right care.
Oh man, let's double click a little bit into it. So where you started from B2C, so you're looking like, hey, Ethan, how can we help you when you walk into an office understand what the menu of things are and how much they cost, and for various forces that wasn't the right path. But the way where you've landed is identifying that, wow, another large piece of this puzzle is who is making the plans that you are even able to access, through your job, and helping those people better identify what it is. Because I guess what you're saying, and this is interesting, and I've never really put too much thought into it, but the plans, since most plans, health plans, are run through companies, the end customer, if you will, from the health insurance companies really is that HR person who's deciding whether they're not going to buy X number of subscriptions to your product, or at least put it as an option for your employees. So, as put on the hat of the health insurance company, the product side of the health insurance company, the people I really care about are the folks that you are talking to, the HR folks who are determining which healthcare plan to use, and that actually determines my, to many degrees, in many ways, that determines my success rather than the actual happiness of the end user. Not to say they don't think that way, but when it comes down to, who is their customer really is this B2B HR counterpart.
You got it. Yeah. And I
Wow.
mean, the silver lining in all this is the HR leader, they're really there to represent the voice of the employees. That the things that they think are critical are, firstly, how engaged and happy are our employees with their benefits, and are they productive because they have access to the right healthcare? And then, are we paying the appropriate amount for the amount of access and services that our employees are getting? And so, what we learned in going through that discovery was HR leaders were not equipped with the right data to be able to make the informed choices that they needed to about the different plans that they should be building and designing from the bottom up. And once they hit go on that, the information never really passes down to the employee or the employee's family to be able to make the most of that plan, because there's huge variation in the cost of care even within a single plan. And we should have the power and the knowledge to be able to make the right decisions about where we get care, based on convenience, based on access, based on cost. And really, that's what we're focused on doing.
Oh, that's fantastic. And what's next for Handle?
We're we've had a lot of success this year. It's been a very exciting journey for us, finding the beginnings of product market fit, and really starting to see what true value looks like for our customers and users. We're building a wait list at the moment of customers that want to work with us into next year, and so we're on the verge of closing our seed round, actually, and that's going to help us to essentially double our team in size, and with that, really focus on building out version 2 of our platform, which will be far more user friendly, and it will help us to hit the scale that we need to serve, hopefully, a huge number of clients going into next year.
That's fantastic, Ahmed. And yeah, please help this solve this problem. It's something we need help with. Um, Grounding this in LA. What's the most LA thing that's happened to you? And this can be tech related or not.
Yes. Okay. So we mentioned, I think, at the beginning that I'm from New Zealand originally, and so in New Zealand, the biggest sport in the nation is rugby. And so rugby is another thing that's in my DNA, right?
Nice.
And so every place I go to, I usually try and find a local rugby team. And the most LA thing about rugby in LA is that it's rugby on the beach. And so that's been my experience.
Oh, that's fantastic. And I mean, I've seen some of those folks in Hermosa Beach. I don't know if that's your crew, but
No,
uh,
I play up near Venice, actually, but yeah,
there's competing clubs
yeah,
there.
exactly.
Wow.
Apparently, it's the fastest growing sport in the US, collegiate sport in the US. So there you
Beach
go.
rugby or just rugby?
Just rugby, but I
Okay.
would highly recommend beach rugby. It's way more LA and way more fun.
Oh, that's fantastic. I know good views and good ocean air.
Exactly.
Well, thank you again for stopping by, Ahmed. We're speaking with Ahmed Marmoush, the CEO and founder of Handle Health. So thanks so much for coming down.
Thank you so much for having me.
I'd like to thank our sponsors again, PMALA and Unita. Thank you all for listening to us. And if you like what you hear, please smash that subscribe button. Thanks again for joining us, and we'll catch you next time on Founders in LA.